This is Christina Coyle. This is Nursing 210, video number 1, head, face, neck, and skin assessment. Normally, before you go and you meet with the patient, you will go ahead and wash your hands. You'll go in, you will introduce yourself, you will provide privacy, you will go ahead and start your assessment by visualizing or observing the patient. So that's what we're going to start. So the first thing that I want to do is I want to look at my patient, and I'm going to start with her skin assessment. I'm going to look at the areas that I see, and there's a lot that I can tell from just looking at the skin. I can see the color, I can see if there's any kind of rashes, I can tell if there's any kind of edema from looking. I can see if there's any type of eczema, and these are all things that we want to visualize and look at first. Right now I'm going to go ahead and look. It looks like she's got some macules, some freckles from sun. Do you use sunscreen?
No.
No, okay. And you probably had red hair when you were little. Is that true?
Yes.
Okay. And that would be symptom of going ahead and having the macules, those little beauty marks on her now. And I can see that she has some primary ones across the bridge of her nose, up around the eyes, also on the arms, and so they're like Vera said, they're scattered throughout her arms, and I do not see any on her legs. I see no evidence on her legs of any type of varicosities, no problems with that. Her skin, the next thing we will do is we will assess the temperature, and I will compare the skin on the right to the left, and we will compare bilaterally and make sure that the temperature should be about the same on each side. So the first thing that we're going to do is I'm going to feel with the dorsal part of my hand, and her face is somewhat cool. Same on both sides. We'll go to the arms. Arms are cool. It must be cool in here now. Same on that side as well. And the feet and legs. Legs are just a little bit cooler. Toes. The toes being the coolest. Okay. So the arms are, she's pink. Her texture is smooth. They're a little bit chilly. Her legs are a little bit colder than the arms, with the toes being the farthest away from the heart, so they're the coolest. And that everything is equal bilaterally, same as one side as the other. The next thing that we're going to look at is nails, and we'll look at both her hands and her feet. Her hands, her nails are clean, they're clear. Capillary refill on the right hand is less than 3 seconds. The nails are all attached well to the nail bed. They're a little bit thicker. They're healthy. The other hand, the nails are also all within 3 seconds, and there's no sign of any type of spooning or any kind of splinter hemorrhaging. So the nails are all within normal limits on the hands. The feet, capillary refill is all within 3 seconds. She does have nail polish on her feet, on her toes, so the bottom part I still can see though. There is no thickening of the toes, no symptoms of any kind of mycosis at all. They are clean, clear, everything is affixed to the nail bed without a problem. And that concludes the nail part. We do, however, want to check and make sure that there are no signs of any type of clubbing of the fingers. So I'm going to have her go ahead and put her hands together. We'll start with the thumbs, and then we'll do the fingers, and then do individually. Okay. And there is no evidence of clubbing of the fingers. The next thing that I would do is I would go ahead and also go ahead and do her capillary refill. Her capillary refill and her O2. So I'll let that sit while I talk for just a few seconds. The next thing we want to look at is the area of the neck, and we want to compare the left to the right. And I'm looking for the area of her trachea. We want to look and make sure that it's midline. So I will go ahead and find her O2 is 97 and her heart rate is 81, which is within normal limits. Her substernal notch is right here. Okay. So her trachea, what that means is her trachea should be midline. It should be right in the middle, and it is. So it is midline to the neck. The next thing we're going to look at visually is the features of her face and her head. Her head is round. It's symmetrical. What's on one side of her face is the same on the other. I'm looking for any kind of ptosis, any kind of drooping of the eyelids. I do not see that. I do not see any difference in the muscles of her face. One side is not different from the other, and we will further assess that when we do cranial nerve 5 and 7. So the next thing we're going to visually inspect would be your hair, and the things we look at with hair are we look at the amount of moisture in the hair, and it looks very clean from here. It looks like it's well hydrated. It is soft to the touch. It is curly. There are no evidence of splitting ends, which is good, so it is dry. The hair looks like it is all dispersed evenly onto the head, and I'll take a closer look, and I will come around to the side. Her hair, there are no signs of any kind of lesions. I see no lesions. I see no evidence of dandruff or seborrheic. I see no infestations. Her scalp is clean, and her scalp is also freely movable to her head, and that is very good. That is all within normal limits. What I'd like her to do right now is go ahead and take a drink of water, and we're going to head and going to look to make sure that her cartilage and her hyoid bone are moving up when she drinks. Okay, and that did happen, so that is also within normal limits. Our next thing that we're going to do is we're going to, let me get you to take your glasses off for a moment, thank you. We're going to look at her paranasal sinuses, and I'm going to have her close her eyes and let me know if you have any pain. And I see no signs of swelling, or patient does not complain of any pain in those areas, so they look like they're within normal limits. The next thing we want to check is we want to check TMJ. We want to make sure that each patient has the ability to chew and use their muscles without having pain in their face or pain in their neck, and we'll go ahead and take a look at that next. So I'm going to have the patient open and close her mouth. Move your jaw side to side. Push your jaw out and push against my hand. Okay. That tells me that cranial nerve number 5 is intact. It tells me that she has strength in her muscles to be able to chew and for mastication and for being able to swallow. and that is good. The next thing we will look at is cranial nerve number 7. So I'm going to go ahead and get you to do some face gymnastics. I'm going to have you smile with your teeth, frown, have you lift up your eyelid, eyebrows. Okay, I'm going to have you, let's see, puff your cheeks out, purse your lips. Okay, good. That we looked at was cranial nerve number 7, and that is also within normal limits and intact. The next thing that we would like to do in this exam is to take a look at your lymph nodes. And lymph nodes are not normally visible to the eye. It's something that if they are inflamed or have infected, then you might see them. Also, if there's some kind of immune response to allergen, she may also have some inflamed lymph nodes. So we're going to go ahead and check each one. The first thing that we will do is the preauricle and the postauricle, the occipital, and that all feels good. The sublingual, the submaxillary, and the submental. Those are also all within normal limits. Next, we will look at the deep chains that are in your neck, and we have the anterior cervical, the posterior cervical, and the deep cervical. Also, the supraclavicular right here, and that all feels good. I'm not feeling any evidence of any nodes being present. Did you have any pain in those?
No pain.
Okay. The next thing that we look at is the thyroid gland. Now, the thyroid gland is like the lymph nodes in the fact that you don't normally see that. It's not something you would see unless maybe the person was drinking, because it is attached to the windpipe, and you may see that move, or you may not. So we're going to go ahead and palpitate that and check to see if there's any kind of nodules in there, or if it feels like it is sticking out. So let's go ahead and do that. I'm going to have the patient drop her head forward and to the right slightly. I'm going to displace with my left hand and palpitate the thyroid with my right, and then I will have her turn the other way, and I will displace with my right and palpitate with my left. And I feel no evidence of an inflamed thyroid. If she did have an inflamed thyroid, they may order some tests and go ahead and further evaluate that. If her thyroid was enlarged, we would also want to listen to it and make sure that we heard no bruise or swishing sounds, which would happen because of the increased size, would increase the blood flow. So we'll go ahead and listen to that. Now, ordinarily, we would listen with the bell of the stethoscope. I do not hear any swishing sounds. The other thing is, when we look at the neck, we want to we touched very briefly on JVD, jugular vein distension, and she does not have that. We also want to look at the carotids. Now, the carotids on the left and the right side of the neck, we want to palpitate them individually, one at a time, and we want to compare the left with the right and make sure that there is no change from the left to the right as far as the blood flow goes. So we'll go ahead and palpitate first, and then I'll go ahead and auscultate. Okay. All right. And they are equal bilateral. Okay, so there are no evidence of anything abnormal. Her carotids are within normal limits. And that will conclude our head, face, neck, and skin assessment. Thank you. Did I miss anything?
You got everything that time.
You sure?
You okay?
I'm beat. All right, so let's see here. We need to see if I can do this. These kids are so into this tech stuff.